This video is on tuberculosis. Tuberculosis is a lung infection of the bacterium Mycobacterium tuberculosis and affects some areas more than others, such as certain parts of Asia are more likely to be affected. So let's look at the pathology. It's a caseating granuloma, opposed to most other granulomas which are non-caseating. And this is a result of cell-mediated immune response that goes around for 10 days to 3 weeks. So initially there's a typical primary or GON complex, and the Mycobacterium tuberculosis is surrounded and killed by macrophages, causing a local or focus of caseation, usually the middle 2/3 due to how the lung is being perfused. And then it can spread to damage the higher lymph nodes. Then this causes a secondary influx of neutrophils as a general inflammation principle because macrophages release chemotactic signals that call over the neutrophils, and the neutrophils can then release elastases, MMPs, and this causes a cavity. This can progress. So if there's progressive primary TB is when there's an insufficient host response. So the caseation from the typical primary GON complex enlarges, then no longer focus. The foci join together and you get satellite lesions. If it spreads even more, you get massive hematogenous dissemination, or miliary TB, so essentially gets into the blood because the lesion is so large that it encroaches on the blood vessels to spread around the body. This makes diagnosis very important. So the Mantoux test is one that's quite relatively easily done. It's an intradermal injection of the Mycobacterium tuberculosis protein derivative. And then you monitor for a cell-mediated immune response, just like what would happen in the infection. And this size of induration is reflected of the immune response, and you measure it after 2 to 3 days because it is a delayed hypersensitivity reaction. So what size of induration is positive? It depends on your factors. So 10 millimeters may be considered positive if you have risk factors for TB, such as being in that country for too long. But for the general population without risk factors, 15 millimeters is considered positive. It's also important to note that you can get a positive test if you've had a BCG vaccine, so a vaccine against tuberculosis, or some other Mycobacterium infection, not necessarily affecting the lung parenchyma in the pathology we talked about. The gold standard, however, is the quantiferin TB because it doesn't have those problems. Incubation of the whole blood and then reacted with TB antigens, and then measure the alpha released by the T cells. A positive result means tuberculosis infection, so not a vaccine, but again doesn't specify what kind of TB infection. The management is complex, and there are 4 main drugs which are used. So one of the main ones is isoniazid, which blocks synthesis of mycolic acid to inhibit cell wall synthesis. Adverse effects include hepatotoxicity, but importantly neutropenia, thrombocytopenia, so there are more risks of other bacterial infection as well as bleeding disorders. You can also get neuropathy and rash. Rifampicin inhibits RNA transcription, but can cause orange discoloration, as well as the same adverse effects of isoniazid. Pyrazinamide blocks fatty acid synthase to also inhibit cell wall synthesis of the Mycobacterium. Adverse effects include hyperuricemia, so if you have gout or at risk of gout, you've got to be careful, as well as hepatotoxicity and thrombocytopenia. Ethambutol is the final drug, and its mechanism of action is also to inhibit the cell wall synthesis. So these 4 drugs, apart from rifampicin, inhibits the cell wall, if you don't want to memorize the nitty-gritty of the mechanism of action. Adverse effects include optic neuropathy, hepatotoxicity, and rash. You can do a short course. If the organisms are susceptible to the drugs, the patient is likely to be compliant and there's not being significant spread, so there's no extensive cavitation or miliary or central nervous system TB. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.